Stop scrubbing your teeth like you're cleaning the kitchen floor. Most people think they're cleaning their teeth, but they're actually just sawing away their gums. This one mistake could be the reason why you have sensitive teeth, gum recession, and in years to come, have a dental bill of over $10,000. Today, I'm showing you the modified BAS. It's the gold standard technique that we use in dental school and virtually nobody is doing at home. If you want to keep your natural teeth for the rest of your life, you need to change your angle. Most of us were taught the habit of brushing whenever we were 3 years old, but we were never actually taught the technique. A lot of us will focus on the white part of our teeth, but not the gums. Bacteria hide in something called the gingival sulcus, and that's a tiny little pocket where the tooth meets against the gum. And if you don't clean that little pocket, you're basically a ticking time bomb for gum disease. By the end of this video, you'll know the exact tools that you need to use and the little wiggle and flick move that changes everything. But first, we need to have a talk about what tools you're actually going to be using to clean your teeth. So I see patients every day that want to use a firm or a medium toothbrush, thinking that they're going to be cleaning away stains more effectively. But essentially, it's like using a piece of steel wool to clean your car. You're just going to be scratching away the paint job, but also you're going to be causing enamel abrasion. You want soft bristles, period. They are flexible enough to get onto the gum line and clean any bacteria that are there. As for toothpaste, you need something with fluoride in it. If you're fluoride free, maybe consider something with nanohydroxyapatite. Nanohydroxyapatite is also very good for sensitive teeth. So the big question, do you need an electric brush? Research shows that oscillating rotating heads clean plaque up to about 21% better than what you can with a manual toothbrush. But it's not just a motor that's the difference, you're also going to get a pressure sensor. And this basically just turns brushing into easy mode, because it's going to start to tell you whenever you're brushing too aggressive, even whenever you're brushing too light. So if you're team electric or if you're team manual, let me know in the comments. I want to know what the split is. Okay, so most people will go in flat. Don't do that. Tilt the brush head at a 45-degree angle toward the gum line. You want those bristles to literally slide into that pocket that we talked about, and this is where the magic starts to happen. So forget those long scrubbing motions. Use tiny vibratory circular motions. And this is the best way to disrupt that plaque biofilm. Make sure to focus on about 2 teeth at a time and stay on those teeth for about 10 seconds. Then move on to the next teeth. And now this is what most people start to miss. After you've done those circles, you do a little flick, and that moves any of that plaque away from the gum line, away from the tooth. So it's kind of like a wiggle and a flick. This sweeps the loosened debris plaque out of the pocket and away from the tooth. So divide your mouth into 4 quadrants, and I want you to spend 30 seconds in each quadrant. Don't forget to do the tongue side of your teeth, because that's actually where most of the tartar is going to build up, and it's where most people forget and miss. And for your front teeth, you might have to tilt the toothbrush vertically and use the toe or the tip of the toothbrush to do that flick away. If you're getting any value from this video, please do hit the like button. Don't forget to subscribe. It helps this video reach other people who might be brushing their teeth wrong. So I want to make a quick distinction at this point of the video. If you are using a manual toothbrush, you are the engine. You are the power source for those circular motions, for those vibrations. If you are using an electric toothbrush, the motor is going to do all of that vibration, circular motion, sweeping away. That's going to do all of that for you. Your job with the electric toothbrush is to position it at the right angle, that 45-degree angle, press the brush up against the tooth and glide it along each tooth. Don't scrub with the electric toothbrush. You're only going to start to confuse things, and that's when you can potentially start to cause damage. A hard truth about this is that brushing is actually only going to clean about 60% of your tooth. That other 40% is the surfaces that are in between your teeth, and the brush cannot reach those places. Think of it as like washing your hands, but not cleaning in between your fingers. Whether it's floss or whether it's interdental brushes or a water flosser, if you don't clean that remaining 40%, you're leaving yourself open to cavities, gum disease, and other potential dental issues. So soft bristles, 45-degree angle, and circles and the flick. It only takes 2 minutes twice a day, but those 4 minutes in your day can save you thousands and thousands in dental treatment costs, and more importantly, help you keep your teeth and your smile for longer. Now, if you want to make sure you're not undoing all of that hard work, maybe watch this video next. YouTube thinks you might like that one as well.